And you're live.
Hi everyone, Nurse Lina. Today we are 1 day post-op from a revision surgery. We did liposuction to the calves, to the abdomen, to the arms, to the back. And so what was originally recommended for this patient was to do a full tummy tuck to get better contouring, but we only did the liposuction and the J-plasma Renuvion in order to help with that internal heating. So in our practice post-op, it's very important for patients to come in for IV vitamin therapy, hyperbaric chamber, and lymphatic massage, which Michael is doing now. So the lymphatic massage is going to be helping to get rid of all of that fluid that's stuck inside the body, and what that's going to be doing is helping with the healing time. While this stays inside of the patient, it's going to take a lot longer for the body to naturally get rid of it. So this is just advancing the healing process a lot faster. So if we can take a look here, we can see that Michael is working on the calves right now. So a lot of this is swelling in here, and by moving it down towards the incision site, we're helping to release all of that fluid. So we can take a look over here. We see how all of the blood has come out, all of the fluid has come out. And so I see here with our patients that after a few days after their surgery, they're already walking and being able to do so many things by themselves because we have these protocols here in our office. But a lot of other offices that don't do this, I've seen it where patients have a longer recovery time. By doing the IV therapy that we just finished, the patient is getting so many more nutrients and minerals and hydration, and so that's giving them that energy boost that gets depleted during surgery, which is why the day before surgery, our patient actually came in to get the first IV, and now today post-op, 1 day post, is helping to boost the immune system so the patient can feel and heal a lot faster. So right here, Michael is just helping to get rid of that fluid, which is going to be helping with the contouring of the calves. And then we can see here what Dr. Emer was doing by contouring this area. We do have swelling in this area still, and that will go down as time passes, but this lymphatic massage is just going to help to get all of that out. Typically, we do also do the hyperbaric chamber, and what that's doing is exposing the patient to high levels of oxygen, which that oxygen is able to get to the tissue better, and hence more healing, better healing, much faster because you're getting exposure to so much oxygen. Does anyone have any questions?
Can you tell us when can she start working out again?
So working out is going to be on a case-to-case basis depending on how invasive the surgery was. If there was skin cutting, the patient will have to wait a little bit longer, of course. For someone like her, she can start working out. And by working out, I don't mean going back to what she was doing before or anything crazy. You want to start off very light, and that's going to be about 3 weeks-ish. We just kind of want to see how she's doing and go from there. But we definitely want her to be walking around every day after surgery. You don't want to be sitting down. You need to get that blood moving. But in terms of working out, you want to slowly get back into it. Any other questions?
What else can you combine this with? What about hormone therapy?
Yeah, so we work with Dr. Joe, who is a hormone specialist. So if you come in for a consultation with her, she's going to do a blood test with you, and from there she's going to see what you are depleted in hormone-wise, mineral-wise, amino acid-wise, and from there she will provide your body with the necessary supplements in order to help your body reach stabilization. So, and by doing that, people who are having difficulty with hair loss or weight gain, she can help reverse all of that. Other things we can combine this with, after about 2 weeks of surgery, we can have the patient come back and we can do True Sculpt Flex, which is helping to build muscle in the area. So it's kind of similar to when you go to physical therapy and you have weakened muscles from a surgery. You do this thing called True Sculpt Flex, and that's going to help build the muscle in that area. Another thing we can combine it with is external radio frequency. So that's also going to be helping with the swelling in the area by drawing blood flow to the area. And so we typically like to do that about 1 week after surgery.
They're asking if she's alive.
She is. She's alive and well, feeling great.
She is doing awesome. She's just taking a little nap right now, enjoying the massage. So at the beginning, first day post-op, in some areas can be a little bit uncomfortable, but it's honestly like after you get it, you feel like you're getting all these toxins out of your body and kind of wakes the person up. Or sometimes because it's a lot for the body, it makes them very tired, but afterwards they feel great. So patients tend to love getting the lymphatic massages afterwards.
Mike, can you tell us a little bit more about what you're doing right now?
Sure, absolutely. So like Nurse Lina was talking about earlier, I'm just making sure to push all the fluid out of the incision, just so making sure that none of that is building up and that expedites the healing process. We also recommend anywhere from 7 to 14 sessions. This depends on what procedures you're having getting done. And more importantly, the lymphatic massage is super important to make sure that no scar tissue is healing, right? No scar tissue is building up. So that's also our big portion, is want to make sure to get all that fluid out of the body as quickly as possible.
So I also want to mention, prior to the surgery, I was speaking with the patient, and one of her concerns for her calves were that she wasn't able to get the shoes on, her boots on that she normally wanted to wear. It was getting a little bit tight. So by doing just a little bit of liposuction, we're able to decrease the size of her calf. So hopefully after the surgery, after the swelling goes away, she'll be able to wear those same shoes again. All right, guys, if there are no other questions, we'll see you next time. Thanks for checking in. Bye.
All right. 1 second.